Hello and welcome. Today we're diving deep into a common eye condition called pterygium, often referred to as surfer's eye. Pterygium is a non-cancerous growth that can affect your vision and cause discomfort. Join us as we explore what causes it, how it develops, what you can do about it, and how to prevent it. So, what exactly causes pterygium? Well, the exact cause isn't fully understood, but the biggest culprit is prolonged exposure to ultraviolet UV radiation from the sun. Think of it like a sunburn on your eye. Other contributing factors can include chronic eye irritation from dry, dusty, or windy environments. Genetics may also play a role, making some individuals more susceptible than others. Now let's talk about the science behind pterygium, the pathophysiology. Basically, UV radiation damages the conjunctiva, which is the clear membrane covering the white part of your eye. This damage leads to an overgrowth of conjunctival tissue. This growth typically starts on the conjunctiva and extends onto the cornea, the clear front part of your eye. This invasive growth is what causes most of the symptoms associated with pterygium. Pterygium is a fairly common condition, especially in regions with high levels of sunlight exposure, such as tropical and subtropical areas. People who spend a lot of time outdoors, like surfers, farmers, and construction workers, are at a higher risk. The prevalence of pterygium increases with age, and it's often seen more frequently in men than in women. How do you know if you have a pterygium? The symptoms can vary depending on the size and extent of the growth. Some people may not experience any symptoms at all, while others may have noticeable redness, irritation, and a gritty sensation in the eye. As the pterygium grows, it can distort the cornea, leading to blurred or double vision. In advanced cases, it can even obstruct the pupil, significantly impairing vision. Diagnosing a pterygium is usually straightforward. An ophthalmologist or optometrist can typically diagnose it during a routine eye exam. They'll examine your eye with a slit lamp, which is a special microscope that provides a magnified view of the eye's structures. This allows them to assess the size, shape, and extent of the pterygium. In some cases, corneal topography may be used to assess the impact on the shape of the cornea. Pterygia are sometimes classified based on their size and severity. A small pterygium may only involve the conjunctiva, while a larger one can extend significantly onto the cornea. They can also be classified based on their appearance, such as atrophic and flat or fleshy, thick and vascularized. However, treatment decisions are generally based on the symptoms and impact on vision rather than a specific classification. The treatment for pterygium depends on the severity of the symptoms. If the pterygium is small and not causing significant discomfort or vision problems, observation and lubrication with artificial tears may be all that's needed. For more bothersome symptoms, topical steroid eye drops can help reduce inflammation and redness. However, these should be used sparingly and under the guidance of an eye doctor. If the pterygium is significantly impacting vision or causing persistent discomfort, surgical removal may be necessary. Several surgical techniques exist, including simple excision, conjunctival autograft, and amniotic membrane transplantation. Each technique has its pros and cons, and the best option will depend on the individual's specific situation. Prevention is key when it comes to pterygium. The best way to prevent pterygium is to protect your eyes from UV radiation. Wear sunglasses that block 100% of UVA and rays whenever you're outdoors, even on cloudy days. A wide-brimmed hat can also provide additional protection. If you live in a dry or windy environment, use lubricating eye drops to keep your eyes moist and reduce irritation. The prognosis for pterygium is generally good. Surgical removal is often successful in improving vision and relieving symptoms. However, there is a risk of recurrence, especially in younger individuals. Recent research is focusing on developing new surgical techniques and adjunctive therapies to reduce the risk of recurrence. Amniotic membrane transplantation and the use of certain medications during or after surgery have shown promise in minimizing recurrence rates. Continued advancements in ophthalmology are constantly improving the management of pterygium, leading to better outcomes for patients.